Hi guys, this is Tanis Hayden. My presentation is going to be on paraphilic disorder. So paraphilia is an emotional disorder. Para is derived from the Greek word around or beside, and philia means to love. This disorder falls into the category of sexual and gender identity disorders. This is said in the DSM to be atypical human behavior and behavior that causes mental distress to a person or makes the person a serious threat to the psychological and physical well being of other individuals. Paraphilic disorder is described as recurrent, intense, sexual arousing fantasies or urges or behaviors that are distressing or disabling. This disorder usually involves inanimate objects, children, or non consenting adults, which causes distress, harm, or the risk of harm to others. This falls into the category of emotional, sexual, and/or identity disorder. Most people with atypical sexual interests do not have a mental disorder. To be diagnosed with a paraphilic disorder, the DSM requires that people with these interests feel emotional distress about their interest, not only the distress resulting from society's disapproval, or have a sexual desire or behavior that involves another person's psychological distress, injury, or death, or a desire for sexual behaviors involving unwilling persons, or a person unable to give legal consent. The pattern of disruptive erotic arousal is usually fairly well developed before puberty. At least three processes are involved. Anxiety or early emotional trauma interferes with normal psychosexual development. The standard pattern of arousal is replaced by another pattern, sometimes through early exposure to highly charged sexual experiences that reinforce the person's experience of sexual pleasure. And the pattern of sexual arousal often acquires symbolic and conditioning elements, like a fetish or being obsessed with an object of arousal. The prevalence of this disorder was very difficult to gauge, given that many people suffer in silence, choose to not ask for help, or these incidents go unreported. Many estimates on prevalence come from people involved in the justice system, which is men 3 to 5%, with just 1 to 6% of those individuals being women. The most common four types of paraphilic disorder are pedophilia, voyeurism, transvestic disorder, and exhibitionism. Pedophilia is described as a psychiatric disorder in which an adult or older adolescent experiences a primary or exclusive sexual attraction to prepubescent children. Voyeurism is the practice of gaining sexual pleasure from watching others when they are naked or engaged in sexual activity. Transvestic disorder is cross-dressing or dressing in the clothes of the opposite gender to become sexually aroused. It must occur over a period of at least 6 months and cause severe distress to the individual in social, occupational, or other important areas of functioning. Exhibitionistic disorder involves exposing one's genitals or sexual organs to non-consenting person. The major risk factors for paraphilic disorder are anxiety, depression, obsessive compulsive disorder, distorted thinking, and suicidal ideation. People with paraphilic disorder may have an impaired or non existent capacity for affection, reciprocal emotional and sexual intimacy with a consenting partner, or other aspects of personal and emotional adjustment may be impaired as well. Some other major risk factors continued. Biological issues such as brain activity during sexual arousal, as well as general brain structure, can be affected with paraphilic disorder. Male paedophilias have lower IQ scores on psychological testing. Risk factors associated with the psychological development of those with paraphilic disorder can include temperament, relationship formation, trauma, repetition, and disrupted development of one's sexuality. What I found to be most interesting about this disorder is the number of subcategories and wide range of disorders within the paraphilic disorder umbrella. I also found it very interesting that not all individuals with these types of urges act on them, and that not all individuals with paraphilic disorder, in fact, have a mental disorder. This disorder was a very interesting one for me to study. It did make me feel a little uncomfortable looking up some of the disorders that fall within the umbrella of paraphilic disorder as well. I also found it very interesting their unconventional sexual arousal patterns in paraphilias are considered pathological disorders when they only follow both of the following. They are intense and persistent, and they can cause significant distress or impairment in social, occupational, or other important areas of functioning, or they harm and have the potential to harm others, i.e., children, non-consenting adults. The treatment for paraphilic disorder is usually psychotherapy in coordination with medication. Psychologists and psychiatrists recommend that this treatment lasts for a minimum of 2 years and is ongoing. The prevention for paraphilic disorder is alleviating some of these psychological risk factors from an early age so that these individuals do not act out on these urges. References: the American Psychiatric Association, Abnormal Psychology, and the Prevalence of Paraphilic Interests and Behaviors in the General Population.